Mr. Courtney.
Thank you, Mr. Chairman, and I strongly support this amendment, which makes a good bill even better. And I would just, again, want to begin my remarks by reminding people that the American people actually expressed loudly their position on this issue not that long ago, last November, when we had a midterm election that had the largest turnout since 1914, that elected a new majority with a plurality of 10 million votes, shattered all of the conventional wisdom about gerrymandered districts and voter suppression, et cetera. Again, people came out in historic numbers. And if you read the exit polls and look at the exit polls, the number one issue was the cost of health care. And if you drill down even deeper below that, it was the cost of prescription drugs. What we are doing today is keeping faith with those folks who came out and said enough is enough, that we are paying too much in this country, both as individual patients, but also as businesses, and we have got to put into effect reforms that are going to do what almost is a given in other parts of the world, that patients are not left with these exorbitant costs for drugs that have been off patent in many instances, like insulin, for many years. So again, when we look at what this amendment is doing, it is allowing the leverage of large groups to negotiate better prices. There is nothing wrong with the transparency bills, which have been described by our friends on the other side. But at the end of the day, transparency does not translate into lower costs unless you have better leverage to negotiate a better price. And you only have to look at the Veterans Administration to see that right here in the good old USA, we have seen the government do good things for veterans in terms of lowering their prescription drug costs. It is wildly popular with folks who, again, served our country and qualify for veterans' health benefits. I know I have the largest military installation in the Northeast with the Groton Sub Base, 10,000 sailors and officers, lots of retirees. The VA drug benefit, again, is viewed as a godsend in terms of lowering people's out-of-pocket costs for critical medications. And we are simply extending that model to the Medicare system. And in this committee, we are extending that model to the commercial market through employer-based plans, because we have jurisdiction over ERISA. Again, something that I think sometimes is overlooked is that that is part of the Education and Labor's work. Back when the Affordable Care Act was passed, this is the committee that originated reforms in the private health insurance market, eliminating pre-existing conditions, extending health coverage to age 26 in families, and the elimination of lifetime limits. And even when our friends tried to repeal the Affordable Care Act, they figured out that age 26 was something to basically leave alone, and pre-existing conditions to leave alone. And what we are doing today is just giving private employers the benefit of lower negotiated prices with the leverage that the government can bring to bear. I would note, however, no one is forcing employer plans to participate in this program. If an employer decides that they think they can get a better deal than what is contemplated in this legislation, they can opt out. This is not mandatory. This is not involuntary. This is not socialism. But what it is just common sense application of market forces in terms of giving the leverage of large numbers of consumers to get a better deal for the American people. In Connecticut, I checked with the insurance department a couple days ago just to see what the impact of prescription drug costs are doing to employer-based plans in our state. And what they have shown is that since 2010, the portion of premiums that employers are paying for health insurance has gone up from 15% of the cost of premium was for prescription drugs. Today, it is 23%. The costs are, again, just burying employers and businesses in terms of higher and higher medical costs. And what this amendment is doing and what this committee's work is doing on Title I is, again, extending the benefit of just good old-fashioned market economics in terms of using leverage to get lower prices for prescription drugs and allow that benefit to go into the private sector so that companies are, again, not going to be struggling with the skyrocketing costs that the Connecticut Insurance Department just reported to me yesterday. So again, I strongly support the chairman's amendment in the nature of a substitute. This bill will be, in my opinion, the most significant piece of legislation on health care that will happen in this Congress. And again, I think this committee should come together in terms of giving it the strongest support possible and providing the relief that people so loudly and clearly voted for last November. I yield back.